Aloha, welcome. I'm Dr. Catherine Taketa-Wong, and I'm here today with, let's see, okay. So aloha, welcome. I'm here today with Dr. Lauren Anderson. I'm Dr. Catherine Taketa-Wong, and my associate and I are here to share with you information that you would rarely get the chance to hear about from your conventional medical doctor and can be hard to find. And yes, there is a lot of information on the internet, but how much is reliable? And if you're not an expert, how will you know? When it comes to digestion, there are many limitations inherent in the conventional approach. So we're going to give you the inside scoop and take you behind the curtain to explain what's really going on inside your body and how to treat the medical issues with natural medicine. Healthy digestion is the foundation of well-being. And when it's working as it should, our body extracts all the necessary nutrients from our food, removes the rest as waste. However, given the state of Americans' food habits, millions of people have all kinds of issues with their digestion. So this Facebook Live event is very important for everyone. How important? Not only because of the person's quality of life. A study by the English government's public health department revealed that almost 20% of deaths worldwide are attributable to an unhealthy diet. So thank you for joining me today. For those who are new to our events, both Dr. Anderson and I are naturopathic physicians, or NDs. Like medical doctors, we attended a four-year medical school. We are trained as primary care physicians. So we order lab tests, write prescriptions, and do school physicals, the same as any other doctor. But with naturopathic medicine, there is much more because we NDs are trained to place nutrition at the forefront of diagnosis and treatment. This is especially true when it comes to digestion. It amazes me, but even today, fewer than 20% of our conventional medical schools require any courses in nutrition. Of those, the offerings are fewer than 25 hours in 4 years. Naturopathic doctors, on the other hand, typically receive 155 hours of training in nutrition in order to be trained on how the power of nutrition can build health from the inside. Applying that knowledge to a patient's condition, whether it's digestion or autism, takes a lot more time than just prescribing a pill. Our office visits are a full hour. In addition, I am also a licensed acupuncturist trained in Chinese medicine, which gives us another powerful natural medicine tool. 3 pillars form the foundation of our practice. They are to heal, to educate, and to empower. Today's event is a perfect example of those pillars. Healthy digestion is the foundation of well-being. We'll focus on natural treatments for gas, bloating, heartburn, constipation, loose stools, diarrhea, and more. Let me reintroduce Dr. Anderson, my esteemed associate. I think we both have seen that when it comes to digestive issues in America, what's common is not necessarily normal, right? For example,
Right.
I mean, people joke about it when they're passing gas all the time. That's often a sign that there's something that they're eating that they are not digesting well, and that could be due to food allergies or sensitivities, or not having enough digestive enzymes, which is really no laughing matter. So, Dr. Anderson, would you explain for our viewers why the body produces gas and why it's not normal to have these huge amounts of gas all the time?
Sure. So gas normally enters your digestive tract, or I always refer to it as your gut tube, when you either swallow air and when there's bacteria in your large intestine. And if any carbohydrates make it down into your large intestine because they weren't digested higher up in your small intestine, they'll ferment there. The bacteria will ferment them and they'll cause gas. And a little bit of this is normal for everybody. So an example of swallowing, right? The bubble water that everybody loves to drink nowadays. Most people, I don't know anybody who can drink those bubble waters and not burp after, because you're ingesting air, and that's totally normal. But if someone's, burping, not eating, or passing gas all day long, that's certainly not normal. And that's going to trigger us to look into potential food sensitivities, food intolerances, and then also to usually look at our gut microbiome, which is the collection of all the bugs that live inside our gut tube, for possible or infections.
Yeah, yeah. I'll joke about it as well, but if you have, gas that's really like, whoa, clear the whole room kind of a thing, right? I mean,
It's
a lot
funny
of
among
people,
families, but
right? But I mean, like if people are having that all the time, that could be a sign of digestive problems, and that we would recommend having some tests done to determine the cause. Um, so, um, that's some of the things. I mean, what are some conditions that you see if people are having like really large amounts of like passing really like foul, super stinky smelling gas all the time? What are some
yeah,
examples
food
of things that could cause
sensitivities.
that?
Yeah, food sensitivities for sure. I
Mm-hmm.
see that, and especially more in pediatric patients,
Mm-hmm.
more so. And then I would say bacterial
Mm-hmm.
infections will
Mm-hmm.
cause a lot of that too, and
Yeah.
even parasites sometimes too. But I'd say the most common would be food sensitivities.
Right.
And I think all these, these specialty tests that we can do, they're not typically offered, by more traditional doctors.
Mm-hmm.
And the traditional practitioners might not even know about these tests, but so patients are often very excited to find out that these options are there, because they want to get, even though everyone's laughing about it, they don't want to be experiencing that symptom all the time.
Right. Yeah. Mm-hmm.
Yeah.
Yeah, definitely. And it can be really embarrassing, right?
Yes.
So,
Yes.
uh, now let's move on to heartburn. Heartburn is especially at all. And then also common are prescriptions for acid blockers, but the majority of people do not have an overproduction of acid. The
Right.
underlying problem is typically some foods that the person is not digesting well, which in turn could cause acid reflux. Um, but in addition, acid blockers can make the problem worse in the long run by limiting the body's ability to produce enough stomach acids to digest the food. And there are, certain foods that tend to trigger reflux in most people, like greasy, fried, or spicy foods. But the majority of the time, it's really not due to an overproduction of acid. So,
Right.
could you talk a little bit about maybe a case of heartburn that you have treated, and what are some of the natural remedies or things that you've done with food or nutrition to be able to help that resolve?
Yeah, sure. So I wanted to quickly start by saying, with the acid blockers, in addition to not digesting your food as well, the acid in your stomach is meant to actually kill bacteria, right? That comes in through your food, through your mouth, so that it doesn't colonize into your gut tube. So it's the digestion of food and then also absorption of nutrients too, that it does affect downstream. So it's multi-layered, where it's really just putting a band-aid on the problem and not
Mm-hmm.
looking into, which is where we're going to come in, right? And we're going to try to figure out what is the underlying cause of this and treat it if there's something to be treated. So the patient that I want to share, for the heartburn case, I started seeing her about a year ago, and I would say her primary digestive concerns were reflux, bloating, nausea, and then self-reported, she called them food intolerances. So what that translated to in the visit was that she almost anything that she ate would cause her symptoms. And so just like having gas all the time, if someone tells you that everything that they eat causes them symptoms, there's definitely something going on.
Right.
Right?
Right.
That is not normal.
Yeah.
If you maybe, are someone who's sensitive to dairy and that gives you gas or whatever, that could be fairly normal. But when someone's saying, I can't eat anything without it causing symptoms,
Right. Yeah.
we're going to try to, yeah, we're definitely going to, so this patient, we decided to start some supplements right away, and when a patient's having acute symptoms, we can treat that with natural medicine while we're going about the process of determining what's going on, right? So it's not like, oh, we just have to wait till the tests come back before we can help you. You might not stay on those things forever, right? A lot of times, right, those end up being short term. So we started this particular patient, I did on digestive enzymes, on some herbs to help with the reflux symptoms and to sort of soothe the gastric mucosa if there was too much acid production going on, probiotics. And then whenever you've got, and this goes across the board, whenever you've got digestive issues, you can almost be sure that you've got a little bit of nutrient deficiencies going on too, right? Because your absorption is not going to be optimal, right? So I always put patients usually on a little bit like a multivitamin or nutrient specific support if they're low in iron, whatever that might be, zinc, if they're having a lot of diarrhea, for example. So this particular patient, we did a comprehensive stool test, which looks at pretty much every aspect of what's going on with their microbiome, all the different bacteria that are there, the good, the bad, and the ugly, I call them. So, you've got all the good bacteria that we want there. Then we've got the ones that are not really considered good. They're just sort of there. And if they overgrow, they can be problematic, right? Like staph or strep. And then the pathogenic ones that can cause a lot of trouble. So we test for all those viruses, parasites, all the markers of inflammation in the gut. We also tested this patient for food sensitivities, food allergies, and a condition called small intestine bacterial overgrowth, which can often cause a lot of the symptoms that she was having, the reflux, nausea, burping, to go back to the burping. So she also did an at-home baking soda test, which we use to figure out if someone's producing enough stomach acid. And this particular patient had tried the acid blockers from her doctor and couldn't take them because they made her really dizzy. So she wasn't on any, she was just having symptoms and wasn't on any treatment. So when we got the test results back, this particular patient actually tested positive for a bacteria called H. pylori, right, which is really common to cause gastric ulcers, ulcers in the small intestine, and the symptoms that this patient was having. She also had overgrowth of some of these, we'll call them the bad bacteria, not the real pathogenic ones, but like strep, I think it was, and a few other. So those two things together, I believed were really causing her symptoms because her food sensitivity and food allergy test came back completely clear. There wasn't really anything problematic, probably because she was already on such a limited diet already, because there were so many things she couldn't tolerate. So this particular patient opted for herbal treatment. The H. pylori treatment, that Astro was recommending, is very heavy on antibiotics. She opted for herbal treatment. We did the treatment over about a 3-month period. At her 4-month follow-up, she reported that, her digestive symptoms had gotten much better, that she was returning to work. So she had actually been off work on disability. And by April, when we followed up, that would have been, let's say, 7 months. She said her digestive symptoms were completely resolved. And she was back to just eating a regular diet. She could tolerate, she was eating healthier now because she noticed she felt a lot better, when she stayed away from things like gluten and dairy, but she could still eat them without it causing a lot of trouble for her. So, these symptoms we were completely able to treat and remedy, and now she's not experiencing them anymore.
Yeah, that's so great.
Yeah.
And that's the thing I love about our medicine, because it's so exciting, so rewarding to see people getting better, right? And it's not just like, oh, here, take this drug, and you have to take this drug for the rest of your life to try to get rid of the symptoms, right? That, like a Band-Aid, but that it's really resolving what the underlying cause is, right? And that people can be able to get back to their life, be able to work, right? And not have all of these issues that are so problematic. And with many of the drugs, including acid blockers, many of them can have side effects too. I mean, there are certain acid blocking drugs that have been associated with a higher risk for dementia. Some of them are associated with higher risk for even things like stroke or heart disease. And so it's really not a solution long term to just say, oh, here, take this
Yeah,
acid blocker medication for the rest of your life.
right, right.
Right? So, yeah.
And interesting because this particular patient, she couldn't tolerate them, so they were not an option for her anyway.
Mm-hmm.
And a lot of patients find their way to us because of that, right?
Right, yeah.
They can't tolerate the medication or whatever, so they're seeking another, option, and then they end up healing
Yeah,
instead.
right, yeah. Um, Now, for our viewers, as you're viewing this and want to talk with me, you could just call or text our office to schedule a free phone consultation. And our patients can see either myself or Dr. Anderson. There's no charge because I don't take patients without talking to them first. And we always want to make sure that what we do will fit your needs. So you'll find all the contact information on our Facebook page. You can also click on the link in the post. And I invite you to visit our website at drtaketa-wong.com. That's drtaketa-wong.com. So there's a few more symptoms that we'll touch on. One is constipation. So Dr. Anderson, could you share with us what is?
Most people would, view constipation as not going as often as they should, right? So maybe someone's going every 3 to 4 days, but it can also be defined as a decrease in the caliber of your stool. So either way, it's a really common problem that people deal with. And I would say our most common triggers are gonna come from diet in one way or the other, right? Either not eating enough of the good stuff or eating too much of the bad stuff, or not getting enough fluid in, right? Those are, and I would say also not enough activity.
And could you share what you mean by like a decrease in the caliber of their stools?
Yeah. So I would say when you're asking, when I'm asking a patient to describe their stool, they'll often describe it as maybe like small little hard little balls, right? So a normal stool, the caliber of it should be more substantial. Whereas if we're dealing with small, harder balls, that is going to point more to constipation.
Yeah, if they're not like getting as much poop out and
getting as much poop.
Yeah,
or it's hard to pass, because it's dry. That is not normal. It shouldn't be that way. And when you're going to the bathroom, another sort of, I guess you could say, expression of constipation is just straining. Maybe you do go every day, but each time you go, you really have to strain to go. And that, of course, down the road can lead to things like hemorrhoids, and diverticulosis, other digestive issues.
Right. Yeah. So, and then, constipation can be caused by many different things. You touched on some of those things. You mentioned like if they're not getting enough fiber or water, those can be common culprits, but there can also be certain medical conditions, sometimes like low thyroid hormone or mitochondrial dysfunction or SIBO or things like that. So do you have a short case that you could share with us with constipation of someone that you worked with and treated and what you saw with that?
I do. And one other thing I would say with medical conditions, another super common one that I see, it's not the case I'm going to share, but it's side effects of medications like opioids.
Yeah.
That's, a major, very common side effect. So the case I'm actually going to discuss for constipation, this is one of my pediatric patients, and it's a little bit more of an acute case, but I want to share it for all the parents out there that have a kid that might be complaining of abdominal pain so bad, like this particular kiddo, 7 years old. He had stayed home for the past 4 days because he told mom each morning, right, like his tummy hurt so bad and he was so nauseous that he couldn't go to school. And then after a few days, his appetite started decreasing and he wasn't really eating well, didn't really want to drink much, was getting more bloated and uncomfortable. And I asked her to bring him in, so I said I'd like to do a physical exam on him too, and then took more details about his history and everything. But when I did the physical exam, I noticed that he was really distended and also felt really firm, and especially in his large intestine colon area, which felt like there was a lot of stool in there. And, because was 7, a 7-year-old, right, is going to be independent typically in the bathroom,
Yeah.
right? So mom's at this point not going to necessarily be keeping a close tab on that stuff. And we just happen to not ask that question yet, right? So we found out that he hadn't gone to the bathroom in like 4 days, right? So it was each day his symptoms were getting worse and worse. And then what we ended up discovering was we sort of did some investigating into what might have led up to it, and found out like this was towards the end of school. And of course, towards the end of school, kids get treats at school, and he does have a lot of food sensitivities, right? So he had gotten a lot of his food sensitivities. It caused constipation. He never thought to mention to mom that he wasn't going to the bathroom. And it did kind of turn in, constipation can definitely turn into more of an acute situation. I don't know if you've ever experienced that with patients, but it can cause a lot of abdominal pain,
Yep.
you know, and a lot of nausea, and a lot of children don't have a way to, right, verbalize that.
Yeah.
So
Yeah.
I share this case mainly too for parents of always think about that. Always like, is it constipation? Because it can really look like something a little bit more, you know, serious,
like appendicitis.
yeah.
Yeah.
Yes. Yeah. So what we ended up doing in the short term was, you know, we wanted to get him to have a bowel movement. And so I recommended to start with abdominal massage, hydration. Gently, we kind of leaned into some magnesium. So magnesium can kind of cause that osmotic diarrhea. But what you have to be careful about with constipation is, and not to get too graphic, but right, if that hard stool sort of forms like a plug at the end of the road, and you start giving like a bunch of fiber and all these things, and you don't get things to move on the other end, right, it can cause even more discomfort. So you need to make sure that you get things moving before you start adding a bunch of fiber, or even like the stimulant type laxative. So if just the abdominal massage and hydration and magnesium doesn't help, you can even use like a, you know, glycerin suppository or something like that in more extreme cases. We didn't have to do that for this child. You know, he had a very large bowel movement. But once we got that moving, then we went on to do testing, right? Further testing of what was going on, and discovered that now he did have a lot of bacteria and yeast overgrowth, which I find in my experience can often be the cause of these food sensitivities that are happening. You know, once you clear those up, they're not nearly as sensitive to those foods. So we treated that, and then also focused on, you know, long-term management of doing things like adding electrolytes to his water to optimize hydration, and then doing a daily smoothie, which is a great way for kids to get all sorts of things in there, right? There's supplements.
Yeah.
You can get your fruits, veg in there. You can get protein in there, you know, so chia seeds, probiotics, berries, avocados, all those things. And mom, you know, can get that in him every day before he goes to school, you know, and then, because you know how it is once they're at school, it's like you're just hoping it goes good. So yeah, so he's been doing, you know, really well ever since that. But you know, that was, he had never experienced constipation to that degree where it had gone on for that long.
Yeah, no, definitely.
I think constipation is probably a common ER visit for abdominal pain too.
Yeah.
More common than we would realize.
Yeah. Yeah, definitely. And then on the other side, there could be things like loose stools and diarrhea. And there's a lot of different causes of things like ongoing, you know, loose stools or diarrhea. And so I'll just mention a few of them, and then ask you to just share a case. But some of the causes that we could see, I mean, we could see food allergies or sensitivities, as you mentioned. And what's the difference between food allergies and sensitivities? Food allergies, your body's IgE to that food, which is what we think of as the typical kind of allergies, where people might get a rash. But sensitivities could be because people make a different kind of antibody to that food, or it could also be that people don't have enough of the enzyme to break that food down. Loose stools or diarrhea also could be caused by things like parasites, ulcerative colitis, Crohn's disease, celiac disease, bile acid malabsorption, chronic inflammation of the pancreas, overactive thyroid, small intestinal bacterial overgrowth. So a lot of different causes, and that's not even all of the things, but those are, I would say, some of the most common things that we see.
Yeah.
So if you could just share a quick case of a patient who had, ongoing diarrhea and loose stools, and what you did to help with that.
Sure.
Yeah.
So this patient came in with a 1-year history of daily diarrhea. So she was having, 2 to 4 bowel movements every morning, and her bowel, which she described as loose and watery. And then the bowel movement would resolve towards the afternoon, and then she'd be fine in the afternoon and evening, and then the same cycle would start over again in the morning. She had been to the regular medical doctor, her primary care. She'd been to the gastroenterologist, had quite a bit of testing done for pathogenic bacteria, for ova and parasites, all of the kind of standard stuff that we do through our regular lab. And everything came back negative. So she was getting pretty frustrated. So what we did, I ran for her a comprehensive stool, which includes a parasite testing. So that is what she ended up coming back positive, a parasite called Blastocystis hominis, which this particular patient did travel a lot, her history. So it sort of all lined up. And what we ended up doing was, actually, this particular case I wanted to share, because we do, as naturopathic doctors, it is within our scope to prescribe medications, and we do use them, when it's appropriate and we feel like it's worth it, right? And there's not a big risk of harm to the patient and the side effect or anything like that. We're going to go ahead, and plus medications are often covered by insurance, right? So that's a bonus too. So this particular patient, what we decided to do, which I know Dr. Taketa-Wong often treats this way too, where we'll use a pharmaceutical in the beginning to sort of get things under control. If we can do it very targeted, because we know what the organism is. That's the great thing about testing. And same with bacteria. Before you prescribe an antibiotic, you always want to test and find out what you're treating, because you don't want to be giving something, for no reason. So for this particular patient, we did 1 week of a pharmaceutical that was targeted. There's like a 3-month course of herbal follow-up that also includes, what a lot of people don't realize is and that's sort of missing, I think, in the Western approach, is all the support of your other organs when you're going through eliminations in your gut or in your body. So when you kill off these bugs, they release toxins into your bloodstream, and that can cause systemic symptoms, so you need to support your liver, support the gallbladder, support elimination in the body, make sure you're sweating, going to the bathroom regular, right? You're not going to want to go in and give these medications to a patient that has constipation until you resolve it, right? Because they will definitely not feel well while they're going through that treatment. So I think as a whole, we may use the same pharmaceutical, but the big difference in the treatment is that approach where you're looking at the whole body and assisting the whole body in dealing with that medication in the best way possible and whatever potential side effect it has. So this patient, she was feeling better really quickly after that medication. And I would say, and then so it was like, do I have to take the herbal protocol? And I said, yes. I said, yes, because these, a lot of these gut infections, they're just, they're tough to treat, right? And that's part of why they become more chronic, because they'll form these biofilms, which is this protein coating that they hide within, and they'll kind of get deep into your tissues. And doing just a 1 week will sort of just deal with that top layer infection. I call them the first line of defense. That's really causing your symptoms, but it's not, eliminating the problem.
Mm-hmm.
And so she's doing really well. That she's still asymptomatic and almost kind of done with the protocol. So,
Yeah. And I think the other thing with parasites too that many people don't realize, that is often overlooked in conventional medicine, is that you can kill the parasites, but if there's any left over that weren't completely killed, then parasites have a life cycle, and so they can lay eggs, and then when those eggs hatch, then weeks or sometimes months later, then you can get a recurrence of these symptoms with parasites. And so that's another reason why, taking herbs or other kinds of things to make sure that we cover that life cycle so that the parasites don't come back, I think is really important too.
Right.
So, yeah. And also sometimes, people could have several symptoms together. They could have constipation and loose stools that alternate, or they could have gas and bloating and abdominal pain. And if those are the things, then we really need to look at everything that's going on. They could have irritable bowel syndrome, they could have celiac disease, they could have Crohn's disease, ulcerative colitis. There's a lot of different things that could be going on. But even with those, we really need to look at the potential underlying causes, because again, there could be things like food allergies or sensitivities, not enough digestive enzymes, small intestinal bacterial overgrowth, etc. So, yeah. So for our viewers, I trust our discussion about digestion has been valuable for you. If your doctor doesn't have the time to educate you like we're doing here today, you're welcome to talk with us personally about any health concerns that you have, so that you too can feel empowered with your health. So to do so, just call or text our office to schedule a free phone consultation with me. There's no charge, because both Dr. Anderson and I don't take new patients without me talking to them first, because we always want to make sure that what we do is going to fit your needs. You'll find all the contact information on our Facebook page, and also a link to our online supplement store with a post in this video. I'll also invite you to visit our website at drtaketa-wong.com. That's drtaketa-wong.com. So thank you. I look forward to seeing you all again in another 2 weeks. Aloha.